I'm Dr Natalia Novikova. I'm a gynaecologist. I have practice in Cape Town and in Johannesburg, and my special interests in medicine are obviously gynecology, minimally invasive surgery, as well as a new field, cosmetic gynecology. We are going to talk about hysterectomy. It's a surgical procedure to remove the uterus or the womb. So why would one have a hysterectomy? Various reasons. Heavy bleeding that we couldn't sort out with less invasive options. So for example, if someone has heavy bleeding with no cause but just, let's say, hormonal changes, and we've tried non-hormonal treatments, we've tried hormonal treatments such as progesterone, we might have tried intrauterine device called Mirena, we might have even tried procedure called endometrial ablation. So after trying all of those, we still can't sort out this heavy bleeding, which generally happens in women in their 40s, not so much in their 50s or 30s. Then we would recommend a hysterectomy. Women who have fibroids that are large and they have completed their family, so they don't need the uterus anymore to carry the pregnancy, would be recommended to have a hysterectomy. Women with cancer, uterine cancer, sometimes cervical cancer or ovarian cancer, would also end up with hysterectomy as part of their treatment plan. Not all cancers would be treated this way, but it's one of the options that would be discussed in a particular situation. Hysterectomies are not done for family planning. So for example, if someone does not want to have any more children and they come to have a hysterectomy, would that be a right option? Sometimes I see patients who request a hysterectomy just because they want a hysterectomy for no other reasons. And in such cases, at times we do perform them, and I would seek an opinion of another specialist gynecologist before I would proceed with such procedure, because once we do it, we can't undo it. There is a possibility of uterine transplant, but it's quite complicated, so it's not really something that is done actually in South Africa, and it's certainly one of my least favorite procedures in gynecology. Hysterectomy can also be done for women who have severe endometriosis or adenomyosis, which is endometriosis in the uterus. And we would have tried all kinds of other options for such patients, and let's say we couldn't achieve the good results and they still have pain, and then the hysterectomy would be an option. Sometimes we do a hysterectomy as a part of a treatment of women with prolapse. So when they have sagging uterus, vagina, bladder wall, bowel wall, prolapsing through the vagina, sometimes we remove the uterus and fix a vaginal prolapse. So it would be just part of the treatment of vaginal prolapse. The hysterectomy can be performed in 3 different ways. We can do hysterectomy vaginally, which is the least invasive option because you end up with no cuts on your body and only cuts in the vagina that you don't see or feel. And the uterus removes through the vagina. As you can imagine, it can only be done for certain size of the uteruses. It can be done through a keyhole surgery where a woman ends up with 4 little scars. The biggest one is 1 centimeter in the belly button and 3 others ½ centimeter. We use CO2 gas to blow up the tummy to be able to see, and instruments that are kind of long sticks to operate, watching on the screen what we do with the camera inside of the tummy. We disconnect uterus from ligaments in the tummy and then remove it vaginally and stitch vaginal skin. Sometimes we leave the ovaries, sometimes we remove the ovaries, depending on what the reason for hysterectomy is and depending on the age of the woman. In most cases, the ovaries are left behind, and the ovaries would be only removed electively in women who are older than 65, because until that age there is still some ovarian hormonal production that occurs. Of course, if a woman has ovarian cancer or any kind of pathology on the ovaries, we would remove the ovaries as well. And the third option is an abdominal hysterectomy that is performed for cesarean type of scar or midline incision if the uterus is ginormous. And the uterus is removed, vagina is stitched. One can do a subtotal hysterectomy where the cervix is left behind. I can't think of doing one in the last 10 years. It's not my choice. I don't see a reason to do that. Or we do a total hysterectomy when the cervix is removed together with uterus, as a part of the uterus. In most cases, I would remove the fallopian tubes together with the uterus, because we'll know that removing fallopian tubes decreases the chances of ovarian cancer later in life. The tubes serve no purpose whatsoever except of delivering sperm into the ovaries and embryo into the uterus. Hence, if we remove the uterus, there is no need to keep the tubes, so I would always remove the tubes. So hysterectomy is usually done for particular reasons. So let's say someone had fibroids, and they would have had heavy bleeding, pain during intercourse, pain in the abdomen, potentially even bloating of the tummy because of the fibroids. So removing the uterus with the fibroids will take away all of those discomforts and symptoms. Hence, women will generally feel better after having a hysterectomy. Can the hysterectomy cause negative side effects? Surely there could be complications. There could be short-term complications such as bladder infection or constipation or pain or hematoma, collection of blood in the tummy after hysterectomy. We would treat all of those and make sure that woman gets back to normal. Long-term effects or negative effects of hysterectomy could be related to adhesions in the pelvis or in the abdomen during surgery. Any surgery can leave adhesions, which may result in some pain. That would be uncommon, and it's not like something that we see all the time. It is possible, even when we leave the ovaries inside, that the blood supply to the ovaries gets disturbed and women start experiencing menopausal symptoms after the hysterectomy. It's not common, but it is possible. There is this great belief that if you have a hysterectomy, you're going to become fat and get into menopause. It's not true. You don't get fat from hysterectomy, you don't get into menopause from hysterectomy. However, if you have a hysterectomy at the average age of menopause or at your age of menopause, you might get to menopause independently of having a hysterectomy or not. If we remove the ovaries, then yes, you will become menopausal for sure. And we would address it in different ways depending on the woman's age. So if we remove ovaries and uterus in someone who is 30, they are going to go on hormonal treatment for many years. If we are removing ovaries and uterus in someone who is 65, they will not need such treatment at all. So it would, the management of those unpleasant symptoms would depend on woman's age. In terms of sexual function, it's not changed after hysterectomy. Not having uterus or cervix doesn't change your ability to have an orgasm or to have normal sexual life. Someone's pelvic organs collapse after hysterectomy, that's possible, but the chances of that are remote. So we do certain things to make sure that vagina is not going to prolapse after hysterectomy by fixing it to ligaments in the pelvis. If someone is prone to prolapse, it's possible, but it's not a common complication.